So myself and Lisa Wood have been very fortunate to be involved in the 50 Lives, 50 Homes evaluation since 2016. So this particular piece of work marks kind of one of the longest housing first evaluation pieces internationally, really, with only a couple of examples that are equal or greater length. So throughout this time, we were really cognizant to try and get a number of measures for these individuals around how long it took to house people, how likely people were to sustain tenancies, but also some measurable data around hospital use and outcomes, and also justice and police outcomes. So they all can be found in the report. So they're not the focus of today's workshop, but there's some really interesting things in there around the impact that housing had on improving health and justice outcomes. So really what we want to do today is dive into some of the recommendations that have come out of this report in particular, but they also build on previous reports as well. So throughout this period, there's many of you that have even participated in interviews. Many of the people you support have participated in interviews, and these recommendations really draw on some of the challenges that people expressed to us throughout that process, particularly with across 3 domains. So what we're going to do is we'll break up into these kind of 3 themes a little bit later on. But the first kind of key domain of recommendations is around that housing sector. So a lot of frustrations around kind of those bureaucratic processes and inability to access housing quickly. There was only a small proportion of people overall that were housed within about a month. From memory, that's about 13% that were housed within a month of signing consent, and challenges around, accessing the priority wait list and being removed after or missing an annual review. And what we found as well, there was quite a number, particularly young people, that abandoned properties for fear around like safety concerns. So some of the recommendations coming around that better matching of supply and demand and trying to get it right for people, rather than just getting into whatever house is available. So what we've seen is where people have sustained and kept their homes for the longest period is where there's been some really intentional support put around them, but also the housing meets some of their other needs, whether that's they're close to a park so that they can walk their dog. They might have a balcony if they need some space. They might have a second bedroom if they needed to go back and study. And it's really about some of those extra things to support individuals in their properties. The second kind of key theme that the recommendations came around was that support. So overall, across the by name list more broadly in Perth going forward, a really small proportion of people currently have a caseworker. For individuals that have been sleeping rough for a really long time, that intensive ongoing support really is needed. And that can be, many years down the track. We know from the 50 Lives group, there's some individuals that have now been housed for 5 years that are still getting weekly or twice weekly support through after hours. So some of that flexibility around service delivery models and understanding that sometimes people will need ongoing and lasting support. And some other things around support was, reducing some barriers around access to the NDIS and some of the other alternative support mechanisms. And finally, the last kind of theme of recommendations was really around the embedding of health more broadly into policy and practice. 50 Lives is quite unique compared to other housing first programs internationally, where other housing first programs tended to only have only have health as an outcome measure. So did people improve health and did people reduce hospital use? But for the 50 Lives model, from the outset, key health organisations were involved in the steering group and the working group. You know, even having the nurses embedded within the after hours service. So health was actually a really key part of the, I suppose, service delivery and model design for this program. And, you know, some recommendations around that need for ongoing involvement of health more broadly to future service and service design and delivery, and kind of more investment in that trauma-informed kind of models of care, you know, for this particular group where you do have really chronic long-term rough sleeping, that ability to support people with extensive trauma histories, but also, you know, complex multi-morbidity. So where people have both alcohol and drug use and mental health and physical kind of health conditions all at the same time, you know, and, you know, it might not be solvable in today's session, you know, but that siloing of the system for people to access, you know, mental health services that also support their drug use, or AOD services that support their underlying mental health issues, is a kind of really key thing that came out time and time again, and particularly of concern for young people, where there's that really kind of big gap between some of the youth services cutting off at 2021 in AOD spaces, and people having to then access adult services from 21 when they're really not ready necessarily for that space. So yeah, that's kind of a really brief overview of some of the key things that came out from this evaluation. And, you know, we've tried to make our best efforts to make the recommendations relevant to the sector going forward and not specific to the 50 Lives program, which is now transitioned to Zero project. But, you know, in order to, I suppose, improve the homelessness system and sector more broadly, we've tried to keep these recommendations at that higher level. So yeah, that's kind of a really brief overview. I don't know if anyone had any specific questions around some of the things that came out from the report, but I'll stop myself there.